lasted like 7 days. Now you bleed just 4 to 5 days. You have light bleeding, or some women can have also long and heavy bleeding. Many women also notice other changes like mood changes, getting weight with the same physical activity and with the same diet they did also years ago. They can notice sleeping issues. They can notice changes on the skin, with hair, nails, also getting weight. They can get easily angry, or they notice some anxiety, depression. These are all symptoms that are mostly present in menopause, but they can be also in premenopause. And we know that with premenopause, the ovarian function is decreasing. So the first hormone that the ovaries produce less is progesterone, and later they produce also estrogen. And how we will know if you are in premenopause or menopause, mostly we need to do some investigations, not just gynecological examination, but we do also ultrasound, which it helps us to understand how your ovaries work, to check the ovaries, so if they still have follicles or not. Follicles in ovaries are sacs which contain eggs, and these eggs are also important for us because every month with ovulation we have the possibility of pregnancy. And what we notice on ultrasound, we notice less follicles, and then we also check the uterus as well, the internal part, which is prepared monthly for possible pregnancy. Based on these ultrasound findings, we can tell you approximately how you can expect in the future your cycle, if you have still possibility to get pregnant, because women in premenopause have less possibilities to get pregnant, to conceive naturally, it takes longer, and they have also a higher possibility of miscarriage. Sometimes, unfortunately, ultrasound is not enough, so then we advise also to do some hormonal tests. Mostly all gynecologists advise to do blood tests, but in Alda's clinic we can help you also with other tests, which are done from urine or saliva. These tests are Dutch tests, which can help us not to discover just the level of hormones, so estrogen, progesterone, testosterone, DHEA, but also how your body metabolizes these hormones, especially if we will be discussing about possible treatments to help you to find the best treatment and best solution for your issues. This test can help us to give basic information to discuss, to find the right treatment for you. So the right treatment can be hormonal treatment, or if you are not sure, if you would like to try with hormonal treatment, we can offer you also non-hormonal treatment. The best idea, of course, is hormonal treatment to replace missing hormones, estrogen, progesterone, testosterone, DHEA. But some women cannot take them. Those who were diagnosed breast cancer, who suffered stroke or heart attack, or had in the past deep vein thrombosis, or have active liver disease, unfortunately, they cannot take. So for these women, we can help with other treatments, and my colleagues will talk a little bit more about these non-hormonal treatments. Basic on hormonal treatments, we can offer you conventional HRT, which is actually based only on estradiol and progesterone, or BHRT. These are bioidentical hormones, which are approved by FDA, and they are produced from soy or wild yam. And the advantage of this bioidentical hormonal replacement therapy is that we can add not just estrogen and progesterone, but we can add you also testosterone and DHEA, and women mostly are more satisfied. We have also different options of treatment, so like creams, oral treatment, or vaginal treatment, to find a solution which is more suitable for you. Of course, before we decide about the treatment and the doses, as I told you, we need to do ultrasound, lab blood test, or this urine saliva test. We also always ask patients if they did mammography, because we know that longer treatment with hormonal replacement therapy can increase the risk for breast cancer. But with micronized progesterone, which is actually bioidentical hormonal replacement therapy, the risk for breast cancer is very low. This was also noticed by different researches which have been done since 2002. And important thing is always, if you start with any treatment, to monitor the effect of treatment. So we advise patients to come back first after 3 months to check if they are satisfied with the treatment, if they noticed any improvement in the treatment. Mostly also we do another blood or urine test to check the level of hormone, and then we discuss if the dose will be the same or we will increase. Actually, after we find the right treatment, the right dose and combination of hormones, then we advise to do follow-up consultations at least once per year, because with hormonal treatment, we have to check also the uterus, the ovaries, because there is high probability for some changes also in uterus, not just breast cancer. And on the other side, we also have to think about that some women in menopause will notice also high blood pressure or have high possibility for diabetes, osteoporosis. With these hormones, of course, we can help them to lower the possibility to have osteoporosis, not just to treat menopausal symptoms, but about the osteoporosis and the fact of menopause and treatment will speak our colleague, Dr. Bichanin.
Great, doctor. Thank you very much. This was very comprehensive, and thank you really, because you gave us a lot of details, and this is all leading now to questions that we have for Dr. Bichanin, orthopedic surgeon, and everything related to musculoskeletal issues when we are talking about preparing ourselves for menopause, and also doing prevention, so we go through it easy and we live our life up to full potential after menopause.
Thank you very much. So as an orthopedic surgeon, we mostly deal with the painful bone and joints and injuries, so this is easy. Now the question is, what is the role of the menopause and bone and joint pain? So I'll tell you shortly that basically the estrogen is a molecule that helps you have a healthy bone and a healthy joints. In what way? So for example, estrogen works on a quality on a bone in a sense that through all the life, it prevents bone from dissolving. So maybe you are not aware, but even men, we have a significant level of the estrogen, but which is more or less consistent through the life. Now what happens in the menopause, that certain amount of the estrogen suddenly starts dropping, and then you have less molecules which prevents your bone from dissolving. This is the first thing. And we know now that 5 to 10 years after the menopause, the quality of the bone goes down approximately 10 to 20% if you don't do anything. And then you have a brittle bone, then you might develop osteoporosis. And then with the normal exercises and a small trauma, you can have a fracture of the bone. So it will prevent you from having a quality life. So estrogen on one level works on the bones in a sense that it gives them the good density and the quality. But there is another thing. So estrogen also works as a stimulant for the joints, all the joints in your body, to produce the synovial liquid. Synovial liquid is nothing else but a liquid which helps to lubricate the joints, normally produced through all your life. Now, after the menopause, the quality and quantity of the liquid decreases, so you don't have enough lubrication in your joints. Your joints become more dry, and then all the other things that can happen, inflammation, pain, damage to the cartilage. So you need a good level of the estrogen to have the lubrication of the joint and to have the good quality of the bones. When we talk about the lubrication of the joint, most important molecule is hyaluronic acid. Hyaluronic acid, which nowadays we can apply especially for the knees, hips, or the weight-bearing joints, if needed. If you have lack of hyaluronic acid, and most of the people above the age of 50, they will have some kind of knee stiffness, knee pain, knee dryness, and so on. So this is where we can help. Now, another question is, what do we do in terms of testing to see if you have a problem with the bone and joints? So the regular testing, which is X-ray, you can see, but only when there is advanced level of the osteoarthritis or arthritis in general. You can do an MRI where you can see the details. But there are also some other tests that we also do in longevity clinics. So you can do the DEXA scan or the bone densitometry. So probably it would be a good idea even before the menopause to do the DEXA scan, because you can then see what is your bone density level compared to all the other women of your age. So then you will see you are on the average, or you are better than average, or worse than average. If you are worse than average, it doesn't mean that you have the osteoporosis, but maybe you can build the quality of your bones with some supplements, with exercises, and so on. So this is one of the tests. Then the second test that most commonly used is, of course, the vitamin D level. Why is the vitamin D level important? Because I would say nowadays maybe it's even abused, because whenever you have a bone pain, they would say you do a vitamin D test. And this is why most of the insurances nowadays are not covering regular vitamin D tests, because when I don't know what to do with you, yes. Yeah, but it is important because the lack of vitamin D influences the absorption of the calcium and the quality of your bones. So if you have a deficiency of the vitamin D, which is below, I would say, 20 nanograms per millimole, so this is a deficiency, and you need some kind of supplement if you can not get enough sun or get it in other ways. So I would suggest you do a supplement with a vitamin D, but then the vitamin D, probably you would need also calcium. But even you take a calcium, in order not to for this calcium to be in your heart, in your blood vessels, so you need vitamin K2 to bring it to the bones, okay? So it's not easy, but you need to see if you have deficiency or you have it sufficient. The good thing about the vitamin D is that you can do the test not so often, occasionally. So you do it once, and if you have a deficiency, then in 3 months after the supplementation, or in 6 months, or you do it once a year. It's not very expensive test. Another thing which is important for the bone and joint health is exercise, especially resistance training. Why is that? Because maybe it's not the first thing that comes to your mind, but when you have the astronaut and when we are going to go to space, the main problem when they come back to Earth is they are not allowed to walk. Why? Because there was no pressure in the space, so there is the bone quality is decreased. Same thing here. Why, as an orthopedic surgeon, we push you as soon as possible to put the pressure to do the exercises? Because this is the only way to make your bone stronger. You put the stress, the bone becomes stronger. Of course, you need to have enough vitamin D, calcium, and other supplement. The other value of the stress training or resistance training is the circulation, which helps in general for the bones and the joints, and the quality of the muscles. Stability or active stabilizers of the knee joint, hip joints, spine, you can decrease or avoid lots of orthopedic problems if you train properly. And that's it from my side.
Wonderful. Thank you so much. Very, very grateful.
Thank you so much. I would like to add one thing, that we also have red light therapy in Aldas Longevity Center. So I would like to ask you, is it red light therapy crucial, or it's just additional to vitamin D increase in patients?
So when we talk about vitamin D, probably the best would that you get a natural vitamin D. But Dubai, 6 months we are not outside, or we are rarely outside. So here there is a lot of deficiency of the vitamin D because all our lives are inside. Now, the second way to get the vitamin D is you can take a simple tablet, but then it's a question of the absorption and the quality. So the red light, I don't have personally so much experience, so probably there are better experts than me. But as a additional therapy, I think it's good. I think it's good. Whatever brings your vitamin D level to the normal or the optimal level, and as you feel comfortable.
Thank you very much. Thank you, doctor. This leads us, when we are talking about strength training, this leads us now also to Biljana. Thank you, doctor. Personal trainer, celebrity personal trainer, that actually I was waiting for maybe, please, a year and a half to finally start my trainings with Biljana. And this is how we came after 3 years working together onto idea that Biljana also join our team, because I personally experienced the way that Biljana work, and I experienced her programs, and how actually everything is turning my body into body that I always dreamed about. So Biljana will tell us today also about importance of strength training and which exercises we should do during perimenopause, menopause, and post-menopause.
Thank you, Elena. It's a wonderful introduction for me, and thank you all for coming. So as we are getting older, we know that muscle mass in our body is decreasing, unfortunately. So we are losing around 5% of muscle mass after age of 30 every decade, which is quite terrifying fact, considering that we know the muscles are the biggest organ in our body. The process of losing muscles, it's called sarcopenia, and no one is saved from it, especially the females in perimenopause and menopause. So we know that the muscles, they have many functions. They have physical functions like regulating the blood sugar, glucose, storing the energy, storing the amino acid, which are the biggest builder and of our bodies and immune system. But we speak very little about mental significance of having a big muscle mass and having strong body. So we know now, it's scientifically proven that actually strength training has antidepressive effect. And it's proven that it's even better than psychotherapy or antidepressants as a medication. From the other side, we know that there is studies showing us that the people who are stronger and they have stronger hand grip, they will be saved from cognitive regression when they're getting older. So people who are weaker, they're more prone to get Alzheimer and dementia as they're getting older. Also, I don't know if you know, but professional athletes with a big muscle mass, they have very, very, very little cases of cancer. So maybe 1 in 1,000 will get a cancer if they were professional athletes in the past. I would love to give you one interesting thing I learned. That I don't know if you know, the women in Japan, they don't experience all the symptoms in premenopause, in menopause as the women in West world, because they are taught from the childhood that the perimenopause and menopause is something to be embraced. It's a renewal and rebirth. So there is no word in Japanese language for hot flashes, for example, because they are all learned from the childhood to eat well, to exercise, to love their body, and to basically enjoy their life even if in the older age. In our world here, especially in Dubai, and women who live here, we speak a lot about perimenopause and menopause. Unfortunately, women are entering the perimenopause much earlier than previous generation, and it's never too late to start with the strength training or resistant training, because if there is any lifetime that it's important to focus on more exercising, it's actually when you start approaching the menopause. As a personal trainer, I have excellent results with the ladies between 35 and 55, and you are still able to gain a lot of muscle mass, even though the hormones are disbalanced and you think the insulin resistance is coming, that whatever you eat stuck on your belly, but you can prevent all these symptoms by exercising regularly, eating a proper nutritional plan, and also focusing more on your mental health. Strength training will also help with many symptoms of menopause, like I already mentioned, anxiety, depression, hot flashes, because it regulates the hormones in your body. Just to train and to exercise, body needs to rearrange the hormones on every level and to make them more stable. I also want to mention your sexual health, which is very important for women in perimenopause and menopause. It's proven and tested that after every strength training session or resistant training session, the level of testosterone and also estrogen, they go up. On a long term, if you do exercising or any resistant training, the level of testosterone will stay stable and the level of estrogen will balance more, which will lead us to better libido, better sexual wish, better circulation, better endurance, and everything that is needed that sexually you last longer and you feel healthier. So ladies, if you didn't start, we offer personal trainings and any consultation, whoever is interested to know more. Also, we do offer other treatments that can be added on your exercise routine. We have a great nutritionist, we have a DNA testing, we have a stress test machine, which will tell you a lot about your health and about your fitness. If you have any question, or Jelena can ask something, but I think this was enough as a small introduction.
Thank you, Biljana. I just would like to add how important it is not only for a man who are in their 40s to check their heart and to understand in which state their heart is, but we notice out of 30,000 registered patients in our centers that hardly some women are checking their heart and doing stress test and ECG. So I would like to encourage all of you to do it. Insurance is actually covering it, but women are not testing on a stress test machine their heart, and they don't know in which condition their heart actually is. Yeah, this is one of important things before, you know, like doing really hard workouts. But I can confirm that what Biljana is saying and what I experienced with her and exercising is really helping a lot with prolonging the time related to menopause. I got my fourth baby in my 40s, so I don't feel nothing less fit. I feel even more fit now in my second part of 40s than when I was in my 20s. And yeah, thank you so much for all the work that you are doing with me. I don't know how to thank you. Yeah. So I will introduce you also to Dr. Ljudmila. Thank you, Biljana. Možemo i ovako. I'm a little bit talking Serbian, a little bit English, but Dr. Ljudmila will tell us a few things about unconventional way of tackling perimenopause, menopause, and postmenopause, because Dr. Ljudmila is actually conventional medicine doctor, but she have 20 years of experience in bioresonance. She is one of the top educators and speaker on all biggest world conferences about quantum medicine and bioresonance. So, Dr. Ljudmila, please tell us about unconventional methods that you are using to tackle issues during the menopause.
So, quantum medicine and bioresonance is a new direction in medicine, and we follow up some different things than conventional medicine. For example, what about radiation? We are exposed to the phones, mobiles, computers, e-smog around, and this is something that conventional medicine doesn't check up. But you can have brain fog, you can have fatigue, lack of concentration, drops of energy during the day, problem with sleeping, and many, many other problems. Then in a quantum medicine, we follow up also the scars from previous operations, from inflammations, and also from the emotions. So imagine a group of doctors who is treating you and ask you about your soul, because emotions had a huge impact on our lives, on our health. My personal belief and experience is that 80% of all disease, symptoms, and conditions start from the emotional disbalances. What we also follow up is the influence of the virus, bacteria, parasites, heavy metals, and so on, and intolerances. You know that many scientists are speaking about connection of the gut health and the brain, mind, and there is a lot of people who have intolerances like gluten, dairy, sugar, and so on. Almost every second person have the issue with this. So, okay, you will stop eating certain things, but still the frequencies is present in the body like a scar. And the first intake of gluten or maybe sugar will again bring the same symptoms and same disbalances. We usually think that it is connected to bloating, gases, discomfort, constipation, diarrhea, but it can also be connected to anxiety, depression, skin problems, brain fog, concentration. So with the bioresonance, we can exchange these frequencies and these memories so the patient in the future consume it again without a side effect. And when we come to the theme of perimenopause and menopause, this is something that we speak in a different terms, and my experience with the patients is that we are overwhelmed, fast way of living. We don't sleep proper, we don't eat proper, we are not hydrated in a proper way, and of course, we are emotional beings and it influences us. Did you ever have a situation that you act and react with your family members? You say something, you do on your workplace, at home, and after that you feel guilt because you are overwhelmed, but your reaction was faster than you. It can be because of your hormonal levels who are connected to different impact. And also what I must say is that with the hormones imbalances, not only that the reactions are unpredictable, but our immunity can also goes down because we can have cravings for certain food without reason. It can be during the day or during the night. We can have lack of energy in the morning or in the midday or afternoon and we don't know why. Or we can eat the same way, but still we cannot change anything, and we speak a lot about gain weight and where to start. We come into the circle that we don't know how to exit. I believe that all this connection can influence us in a different way. With the bioresonance method, everything that I spoke, we can not only do the checking and scan the body, we can also do the treatments in a safe and a pleasant way. Then, from the other side, when we are speaking about the emotions, for the ladies, the most sensitive organ by traditional Chinese medicine is the liver. And the main emotion for the liver is anger. The organ is working between 1 to 3 a.m. And if you wake up this time, think that maybe there is an anger inside. I met a lot of patients who are quiet, smiling, but the anger is suppressed deep inside. Maybe we are angry to the other people, but mainly this anger goes to us because we didn't put the boundaries, we did some things that we are not okay with this. Then a lot of ladies who have these issues according to the cycles, perimenopause, menopause, have the emotions of guilt and not good enough in the second energetic center. And all this can be done in cooperation with the whole team of our doctors who will treat you on physical, mental, and emotional level. We are spiritual beings in a physical body, and we need to adjust all this system. One is not enough.
Thank you very much, Dr. Lyudmila. And Dr. Lyudmila is using the most advanced quantum medicine bioresonance devices on which she is testing patients. And actually, I'm very proud, but most of the, not all, but most of bioresonance therapists here in Dubai, they're trained by Dr. Lyudmila. And she's only one who is actually conventional medicine doctor with 20 years experience with also bioresonance. So thank you very much. I appreciate.
Thank you for listening.
And we have a few other things. I don't know if we have 5 minutes more. Sorry? Okay, then tomorrow, if you would like to find out more about Papimi machine, which you had the chance to see on our in our booth, and also about IHHNT machine, which is hypoxia, hyperoxia, and normoxia treatments for trainings of mitochondria. Also about ozone therapies, about vagus nerve therapies, about so many other things which are influencing and preventing symptoms that we will have in perimenopause, and also that will help with inflammations and many other things. We will have Dr. Jessica talking about it. We don't have any more time today, unfortunately, but also Dr. Jessica is available in our booth, and she can answer to all questions related of all these devices that we are using in a therapies in Aldas Longevity Center, because she is a general practitioner in conventional medicine, but also integrative medicine specialist. So just to wrap this up, thank you for coming, and we are looking forward to see you in Aldas Longevity.
Thank you, Yelena, and thank you, doctors. Thank you so much.